Hi everyone. Today we're going to delve into the 3 critical things that Medicare doesn't cover and explore how to potentially reduce the impact to your retirement planning. It's crucial to understand these limitations and to ensure we have a comprehensive approach to healthcare costs in our golden years. I'm Carlos Lopez, Managing Director of Creative Planning. Ready to learn more? Let's get started. One of the first challenges with Medicare is the presence of deductibles and coinsurance. Deductibles are predetermined amounts that you must pay out of pocket before Medicare coverage kicks in, and they act as a threshold that you must meet before coverage actually starts. For Medicare Part A, which covers hospital services, there is a deductible per benefit period. So if you're admitted to the hospital, you would need to pay this amount before Medicare coverage takes effect. For Medicare Part B, which covers doctor's visits and outpatient services, this has a reasonable annual deductible, and after meeting this deductible, you are typically responsible for a coinsurance amount of 20% of the approved cost. Now, these deductibles and coinsurance amounts can add up, especially if you require frequent medical services or hospital stays. So it's important to factor these costs into your retirement budget and explore alternative coverage options. So what is the solution? Consider Medicare supplemental insurance, also known as Medigap, and there's also Medicare Advantage plans. Medigap and Medicare Advantage plans are sold by private insurance companies and can help fill the gaps in your Medicare coverage. They can provide additional coverage for deductibles, coinsurance, and other out-of-pocket expenses, providing you with peace of mind and financial protection. The second area where Medicare falls short is dental and vision care. While Medicare does cover certain medically necessary procedures, routine dental care, dentures, and most vision-related expenses are not included. So maintaining good dental and vision health is crucial for our overall well-being, especially as we age. Unfortunately, without proper coverage, these expenses can add up quickly and become a burden for our retirement savings. To address this gap, it's important to explore standalone dental and vision insurance plans. These plans are specifically tailored to cover routine checkups, dental procedures, eyeglasses, and vision correction. By securing separate coverage for dental and vision care, you can ensure that these essential aspects of your health are adequately protected. The third significant challenge with Medicare is its limited coverage for long-term care services. Medicare does not cover custodial or what we think of long-term care such as assisted living or residential living for seniors, nor does it cover 24-hour in-home skilled nursing care. There are some limited occasions when Medicare will cover hospice care or a skilled nursing facility after a qualified hospital stay, but it's for a short time and it won't provide ongoing care. Medicare Part A and B will cover some intermittent skilled nursing care at a home, but only when ordered by a doctor for some patients who are generally homebound and qualify for this coverage. Long-term care costs can be astronomical and can quickly deplete your retirement savings. Without proper planning, it can become a significant financial burden for both individuals and their families. People are living longer in retirement, and as we age, our needs for long-term care may grow. Planning ahead for long-term care needs is important. For some, their savings will provide enough resources to cover these costs. For others, consider exploring long-term care insurance policies. These policies are designed to help cover the costs associated with nursing home care, assisted living, and in-home care services. They can provide financial protection and can offer you peace of mind knowing that you have coverage in place should the need arise. In conclusion, understanding the limitations of Medicare is crucial for effective retirement planning. We've discussed the 3 critical areas where Medicare falls short: deductibles and coinsurance, dental and vision care, and long-term care. By addressing these gaps and incorporating them into your retirement plan, you can achieve financial security and peace of mind in your golden years. As always, seeking guidance from a knowledgeable financial advisor is essential for creating a comprehensive retirement plan. They can help you navigate these coverage gaps and ensure you're adequately prepared for healthcare costs in retirement. If you don't have a financial advisor, please reach out to us here at Creative Planning. We look forward to meeting you. See you in the next video.